Dr. Herb Yolen, Chief Consultant for Professional Growth Technologies, a consulting company for dentistry and laser therapy. I also maintain a private practice in Brookline, Massachusetts. This is an instructional video on how to make the Miracle Bite Tabs fit properly so they may be as effective as possible. Miracle Bite Tabs and the Easy Fit Proprioceptive Guide are temporary devices that are used for relieving pain, muscle soreness, and dental distress syndrome. Each package of Miracle Bite Tabs comes with written instructions, explanations, and warnings that must be read before proceeding with watching of the videotape and the fabrication of the Miracle Bite Tabs. The following are tools needed for making the Miracle Bite Tabs. First, you need access to water. A kitchen or bathroom sink will work fine. You will need a microwave or a stove to boil the water, 2 stainless steel table knives, ice and ice water, towels or paper napkins, a small pair of scissors or nail clipper, and a mirror at eye height while standing if you are doing this procedure yourself. Look in the mirror and determine which shoulder is higher than the other by using your earlobes as a guide. Choosing the higher side is not critical, but simplifies the adjustment process later. One way to help determine the higher side is to lay a finger on each shoulder, look in the mirror, and see which side is higher. Often the eyes may slant to the contracted side. The next step is to determine which teeth to place the material. A good rule of thumb is to avoid the wisdom teeth, especially if it is tilted going up a ramp in appearance as you stare into the mouth. At best, you may want to just let a little of the tab rest on the forward edge of the wisdom tooth. Remember, if you have missing teeth or large gaps between your teeth, do not place these tabs yourself. Seek out a dentist that can help you. Predetermine the height and or thickness of the Miracle Bite Tab by looking in a mirror and seeing just how far to close your mouth, so your lower front teeth will be free to move without banging into the upper teeth. This is a level selected to rapidly eliminate pain and tenderness to the muscles. Bring the water to a boil and remove the heat source. Glass or porcelain is excellent for holding the heated water because the melted material will not stick to it, as opposed to a metal pot. Empty the contents of 1 package of beads into the heated water. The beads will stick together in one clump and begin to appear totally clear and homogeneous. Place into the glass 2 stainless steel table knives with the handles submerged in water, absorbing the heat into the handles. Do not place the knives onto the clump of material. These knives will become your adjustment tools. Gather the clump of melted material with the end of one of the knives and remove it from the water, and quickly mold it into a wafer as shown. While standing flat on the ground, place the material over the back teeth of the selected side. It is also a good idea to place the material over the teeth in a manner that the table over the teeth is a bit higher on the tongue side than the cheek side. This will give more freedom for craniosacral movement and correction. Now close to the desired level where the lower teeth will avoid banging into the upper teeth regardless of jaw movement. Our goal is to begin hardening the material in the mouth without disturbing the material by closing down on it or dislodging it with the tongue. Therefore, take a piece of ice or dip your finger into cold water and gently rub the material flat, removing the deep indentations of the upper teeth. Please note that the material retains the warmth for a long period of time, and you should keep your tongue away from it as long as possible. Now, take a mouthful of ice water and keep it over the warm tab for 20 to 30 seconds. Do not bite into the tab. Either swallow the water or spit it out into a sink or cup. Note how the material is beginning to appear white as it hardens. Take some more water and hold it over the tab again. If you lift the tab too soon while it is still soft, you will distort the tab. At this point, merely remove the tab if it is too distorted, get your water hot again, and remelt the material and start over. Expect to repeat this process when you first begin this procedure. Begin by lifting the hardening tab by placing your fingers on the front corner of the device. Lift it slightly in the mouth, but do not remove it. This helps to free any material that might be grabbing at the gum line, which is at the neck of the teeth. Gently place it back down against the teeth and make sure the outside has a fairly white color. Remove it gently. Also note that the inside may be clearer and still retaining heat. Dip it into the glass of cold water and quickly place it back on the teeth correctly over the area you removed it from. When finished, you should not be able to dislodge the tab with your tongue. The tab should not wiggle nor pinch your gum. As a novice, most wiggles should be removed by starting the process over. However, you may try to adjust the wiggle by removing the tab and carefully dipping the part of the tab that touches the teeth into the hot water for a second. Quickly place it back on the teeth and attempt to squeeze the tab at the gum line. Remove it. Dip it in the cold water, place it back on the teeth, wait a few moments to see if the wiggle is gone. You may or may not be rubbing too hard on the gum tissue. If it is pinching any tissue or too tight against the teeth in any area, note the area and use the hot knife that has been sitting in the hot water. Use the handle of the table knife for reducing the height of the tabs. Note, I suggest 2 knives so one stays warm at all times. A good idea would be to keep a good supply of hot water handy, as the hot water cools rather quickly. Once the tab is finished to your satisfaction, get ready to make the second side. This side is usually easier. Keep the first tab in the mouth while making the second one. Melt the contents of the second package into boiling water, repeating all the steps you did in making the first tab. The closure on this tab is simplified by the fact that you just close until you bite onto the hardened tab. Open and proceed to cool this tab, fitting it the same way. Be sure to eliminate all wobbles and areas of pressure. The goal is to have both tabs hitting at the same time in a correct manner so that both inner cusps of the molar teeth on both sides are hitting when tapping the teeth closed, and the front teeth are cleared when projecting the lower jaw forward. As you wear these Miracle Bite tabs, you may experience the tight muscles releasing, changing the contact on the tab. This is a good result. Just heat the water and adjust the spot hitting first. As a dentist, I have found the best combination for dealing with dental distress syndrome to be the Miracle Bite tab and low-level laser therapy as a non-invasive way of improving overall health. The purchaser of these Miracle Bite tabs should contact the distributor or healer for more information about dental distress syndrome or low-level laser therapy. Professional Growth Technologies can be reached by calling 800-604-9006 or by logging on to www.pgtconsultants.com.